Okay, welcome everyone. On behalf of the Diversity Council of the Corporate Services Center, welcome to A Conversation with Leaders featuring Dr. Yvette Calderon. I'm Michelle Clemente and I'll be today's moderator. Dr. Calderon is an emergency medicine clinician, researcher, teacher, and mentor. She's known for her clinical research that has focused on two major health disparities in the Bronx and the Lower East Side of Manhattan, HIV and hepatitis C. She developed the first multimedia-based HIV testing and counseling program that has provided testing in the ED, inpatient, dental, and community pharmacies. Dr. Calderon has developed meaningful relationships with the New York State and City Department of Health and has received NIH funding from the National Institute of Child Health and Human Development, the NICHD, to support her endeavors. Dr. Calderon has served on 3 nonprofit organizations, a community advocacy and service nonprofit group, a grassroots mentorship group, and the Emergency Medicine Board of Certification. So welcome, Dr. Calderon.
Thank you. Thank you for having me. I feel quite honored to be here today and to share my story with everyone. So thanks for having me.
So just to begin, can you please tell us a little bit about your story and how you became the person and the professional that you are today?
Sure. I think, it's best to start at the beginning, right? I'm a New Yorker. I was born and raised in New York City. I actually was raised in the very beginning of my life in the Chelsea Projects. And if people don't know where that is, it's like on 10th Avenue in 27th Street. My parents are from Puerto Rico. They were born and raised there. And they came here to New York, and that's where I was born. My brother actually was born in Puerto Rico as well. So we came from a very humble background, financially also quite humble. And then around the time of my high school, we actually moved up to Hell's Kitchen, which, if you guys remember, like in the 60s, late 60s and 70s, the projects were really filled with a lot of drugs, especially heroin. And so, once I got to be a high schooler, my parents really worked very hard to try to get out of there. But even though we were moving into this place in Hell's Kitchen that was newly constructed, the area around Hell's Kitchen again was pretty tough, to say the least. During my high school years, I actually was very blessed to meet a philanthropist by the name of Alice Miller. She actually had a prep program, and this program is a pre-medical program for underrepresented minority kids in the city. And Alice was a big believer, quite wealthy, and an incredible believer that medicine should be diverse, that the people who are in the profession of healthcare should be diverse. And she really believed that. And to her credit, she would raise money, and she had this incredible weekend program. You would go in Saturday and Sunday. There was no homework. It was basically, she wanted to get these kids that were bright and smart into an element where they could actually visualize themselves in medical school. And so we would go either to the Columbia Medical School or to Sinai's Medical School, where there would be medical students that would get paid to teach us, an abbreviated anatomy course or an abbreviated, histology course. And you could just visualize yourself in medical school. It was actually quite cool. It also got you off the streets, and there was no pressure because you didn't have homework or anything, and it was just wonderful. But the best part about it was that Alice really counseled you and coached you. And I remember when it came time to applying for colleges, the most vivid memory I have is going to see her, because she would see all of us who were ready to start applying. And I had my little list, and it was little. My big stretch was going to go to Barnard, and because that's where my mom wanted me to go to, an all-girls school. um, and Alice just, I can remember like it was yesterday, she took out her fountain pen. It was a Mont Blanc fountain pen, brown ink, and she crossed all my schools off. And she started writing Yale, Princeton, Brown, Harvard, UPenn, all these schools, never heard of them, never heard of them. I mean, honestly, I looked at this and I was just like, I'm sorry, Alice, but I don't have the money. My parents don't have the money for me to apply to all these schools, and I don't even know what they are. So it was my first introduction to the Ivies, because at my school, the guidance counselor there, you know, did not see what Alice saw in me. And so, and I share this story because I think it is important to recognize that when, especially when you're young and you get discordant messages about, yes, you can do this. You know, it's always like your parents are saying, yes, you can do this. But when someone from the outside sees a potential in you, it is profound. And so I remembered when I got my first acceptance letter, I was ecstatic. And I had gotten into Brown. So I run to school the next morning, I go to the guidance counselor and I go, look, I got into Brown. And her response was, well, of course you did, Yvette, because, you know, Brown practices affirmative action. So you can imagine the absolute, I can't even put into words how I felt as a 17-year-old, you know, being told by this amazing woman that I could do something, being given the opportunity because she gave me all these financial waivers so that I didn't have to pay anything to apply. And then being told that that was just a farce. You know, I was being accepted because of my race and my color, color of my skin. So, and then she proceeds to say, you know, places like Princeton, however, they do not practice affirmative action. So a week passes by and I get an acceptance to Princeton. Now I'm really confused, right? I mean, what is this? I go back to her and I go, okay, I need to understand something. I got into Princeton, which actually blew her mind. And I said, but what does that mean about Brown now? Right? Because that was the school I wanted to go to. I remember speaking to Alice about this, and her words were, this is just the beginning, right? But you have to be there. You need to be in medicine because we need to have people like you who care about others. And medicine needs to change. There needs to be a diversity in it. And that's where it really started. And that's where my journey started. And from that point on, I have been blessed to meet different people who have seen something about me and my passions and what I wanted to give back to the world and leave as my little legacy. And they've helped me and guided me to where I am right now. So I have been blessed from that perspective. But I will say that the dichotomy of it, the actual dual messaging has always stayed with me. And it's something that I know that women and individuals, underrepresented minorities, they struggle with, which is belonging. Do I really belong here or do I not? And that was a question that, you know, my counselor put in my head a long time ago. And unfortunately, I have to actively, you know, have conversations with myself saying, no, you do belong here. Alice was right.
That's wonderful. Thank you for sharing that.
Sure.
I will tell you, I know you're not watching the chat, but we are. And as you were telling this story, one of our participants wrote, you showed her.
Yeah.
So what are you most proud of in your career? And I know that your career is expansive, but of all of it, what are you the most proud of?
Well, I would say, I mean, there are a couple of things when I think about this question, but I think the thing that I worked so hard to do was to become a full professor. Academics and later on, it took me 10 years before I recognized I wanted to do research. And the reason I recognized it was because it was that time where we were having so many patients come in with HIV, really end stage, they were dying. There were just so many systemic things going around that, and I wanted to make a difference. And I was, again, fortunate to find a colleague who was infectious disease, and we worked together to put together an HIV prevention program. I actually went back to school during that time and got my master's in clinical research. But it was that pathway that led me to become a full professor at Einstein. And it was important because I was never one to wait for compliments from my bosses. That's not how it works, especially in a public hospital system. But I knew the validation of becoming a full professor, that would mean the world to me. And I remember when I got the full professor notice, right? I remember like it was yesterday. Some things are very concrete in my mind, and I think it's because it was those pivotal moments. And I remember going to my direct report in the hospital, and I was, again, so excited. Here, I got my, full professor, wow. And he just looked at me and said, oh, that's good, walked away. My academic chair from another hospital, who was not a warm and fuzzy guy, all right, and never wanted to give you compliments, calls me up and says, so I guess you're a triple threat. You are the only woman who's a full professor in my department, the only woman of color, and you're the youngest attending or faculty that has become a full professor in my faculty. And then he hung up. But to me, that was it. Being a full professor meant I now had a seat at the table, and I also felt like I could be the voice of the patients and communities that really had no voice or didn't feel they had a voice. And that was my, political capital that I needed to enter into that boardroom and be able to sit with everyone else who were full professors, and my voice would then be heard.
Do you think that your work as an emergency department doctor and your work as a full professor are competing priorities?
Oh,
Like,
no.
do you have trouble with juggling those at all?
No, they're very meshed, it's very integrated. When I'm with my team, and you can never do anything alone, you need to have that great team. And I have an amazing team here at Mount Sinai Beth Israel. And you start strategizing, and we do this, right before the year begins, the strategic plan for us in our department. The academic piece, it's just married to the clinical care we give, to the quality of it, to the safety of it, to the ability to do things like what we did when I first got here, which was, HIV was not as big a prominent problem in the Lower East Side and Chinatown, but Hep C was. And so we took the model that we put together up in the Bronx, and we just brought it down here. And we have basically found over 200 patients with active hepatitis C, and we've cured about, I know it's way over 150. So that to me is what it means to be an academic person, because the research director now can write about this and can share with the academic world this incredible program that's a clinical program, helping our patients.
That's working.
Yeah.
Right. That's awesome.
And that's how you jazz up the faculty too, right? It's that self-validation that you've done this work, and now look, you can publish it. You're known as that content expert in this area.
And it was successful.
Yes.
That's really pretty awesome. So to step over a little bit back to something that you said a moment ago, or a few moments ago, what are your thoughts in general, as much as you'd like to expand on them, regarding health disparities in our communities. And do you have any thoughts on how to address them?
Yeah, thank you for asking that question. The work I've done in HIV prevention, Hep C prevention, the support I've given to the faculty who are working now in opiate harm reduction in the emergency department, these are really important things to me because it's all about health disparities, right? And to be able to prevent or to be able to help our patients, and many of our patients are from underrepresented, poor, economically poor areas. Really important to me, and has always been, and why I've dedicated my career to doing work in this area. But what COVID did for me, it's touched all our lives in different ways. And it was when early in the first wave that both my parents got COVID and my father passed away.
I'm sorry.
And there was something that just clicked in me. And it was just like, enough. It's just enough, right? Yes, I've done work in this area of diversity, equity, and inclusion. Yes, it was just like all of a sudden, George Floyd happened, the pandemic, it all collided in my head. And I said, enough. I need to now have conversations with my colleagues, with the residents that are coming into my field, because it's time for all of us to ask our question, what is my responsibility to the elimination of health disparities? And I think we all play a role. It's not just physicians, it's not just nurses, it's everyone that has a hand within healthcare and the transformation of it. I find it astonishing that the IOM comes out with a report that's so blatant that basically says the health outcomes of individuals of color are worse than white individuals, all things being the same, meaning all the socioeconomic structures are the same. So we're not talking about only social determinants of health, because if you say that the social determinants of health are the same for both categories, yet still in all, there's these patients whose health outcomes are worse. We have to ask ourselves why. And if we, the individuals that are caring for these patients, are part of the problem, if our unconscious biases are part of the problem, we need to all work together to figure out ways to deliver safe, equitable care, right? To have our checks and balances so that when there is an unconscious bias of some sort, it's caught, so that the management of these patients are going to be the same and the health outcomes then can be the same. I'm very passionate about it. And as I said before, it just clicked in me that this is the time. This is time for a lot of, conversations around diversity, equity, and inclusion, about racism. It has to be done, or we will never get out of this pattern. And I just feel very strongly that we all have to ask ourselves the question, what is my role now? What do I have to do to start picking away at the things that really don't make sense and should not be part of our work structure?
So in the chat, I will say that one of our members here wrote, agreed, we must form a community around analyzing the gaps and disparities of healthcare and work toward an action plan.
Agreed.
And I will just point out that came from our own Sean Lee, who has had some influence on that roadmap.
That's right. A lot of influence. And actually, I am very proud to be part of that work, and proud to be at Sinai, because I don't see other institutions taking this on as seriously and as aggressively and being so successful at it. There's work to be done, and it's not going to happen overnight. We all know that.
Of course not.
But the fact that we're having these conversations, the fact that the leaders of Sinai are open to having the conversation is huge.
I'm going to just sort of pivot a little bit, just a little, and ask you on anything, on any topic that either you've talked about or maybe that you haven't. What do you know now that you wish you had known then, whenever then happened to be?
I think there's two messages that to me resonate, that I wish I would have learned earlier in my career. I'm quite passionate about the things I'm passionate about. And but when you want to make change or you want your leaders to listen to you, you need data, and you also need to not be passionate at that moment, but to have a conversation. And when I was much younger, the bit of activism in me would be like, oh, but we can't do it this way, which doesn't go far. So I think the one thing I learned is that data is incredibly important, but understanding it is critical, because data can be bad. It could be bad data that is being presented to you. And understanding if the data is good or not is the first step. And then being able to present it in a way that is factual and to be able to justify your position, and always have a justification for your position. And the one thing I've always had is, when I started doing my clinical work, is always asking myself the question, is that the right thing for the patient? And if I could answer yes, then that was it. I knew I wasn't going to make a mistake. Is that the right thing for the community? If I can answer yes, then I know I will make the right choices, because again, it's about being the voice for a community. And as we all know, navigating the health system is just impossible. And so to be able to do that is really important. So data and how you present it and how you justify your position is critical. Those are the things that kind of resonate right now.
We do have a question from the chat. Was there anything that surprised you during COVID that had an impact on you and your responsibilities?
Yeah, I mean, emergency medicine is the type of field that you can go through a bad night. Maybe you can go through a couple of bad days where you're just being bombarded. This was just weeks on end. And the pure exhaustion, the fear that I saw in my colleagues and my nursing staff and the clerical staff, all of that was it just was all consuming for me. It really was. The fear, I mean, I remember going down every day, making sure people's PPE were on correctly when we were getting really bombarded, just starting to go see patients, rounding every day with, the different teams to see how we could make more rooms negative pressure. COVID was a time of high emotions, always. And then the reminder, day after day, people dying without their family members. That will stay with me forever. That was the thing that, I've dedicated my life to taking care of patients and communities, but I couldn't be with my father when he died. Not a thing. Just not right on so many different levels. I know we had to make the decisions, and they were very difficult decisions, but I think there were times where we might have made the decision to do the right thing at BI. And, and I'm sure my colleagues from the other institutions would say the same, because, we couldn't lose our humanity, and I do think COVID tested that. So yeah, COVID taught me a lot of lessons, and some of which I'm still unpacking, to be quite frank. But the emergency department, it was like being in a MASH unit. right? If any of you ever saw MASH, if I'm dating myself,
I
but
did.
it was like that. You know, it was just a constant, just a constant pounding on your emotions. And like I said, you could do it for a day or two, but once you start talking about weeks on end, that's a very different experience.
Right. As a doctor and as a professor, you've had such a positive impact on our community already, both in what you have talked about and what we haven't gotten to. Is there anything on your professional bucket list that you're working toward?
Yeah, I mean, I love spending time with the high school kids that we mentor at BI. I think professionally, you know, I need to put a lot of emphasis on the young people who are coming up. We need to work really, as a community, need to work really hard at diversifying medicine and healthcare. That is going to be critical as part of the steps to, you know, unraveling the health disparities and eliminating it, is really being able to have a workforce that actually looks like the patients that and communities that you're taking care of. That's a longer, I think, a longer road, but I am very invested in doing that. Many moons ago, when I just became an attending, my friend, Dr. Lynn Holden, and I decided we would put together something kind of like her pipeline program and my pipeline program that Alice Miller had. And we went out there and we got money and we did our philanthropy, you know, walked the walk, and then she took that and she actually now is the president of the nonprofit organization Mentoring in Medicine. And so, you know, I feel strongly that these are the things that are going to help young kids, because the Alice Millers are not out there as much anymore. And we really need to create that. We need to create opportunities where our kids feel that that they can actually visualize themselves, like I did, you know, way back when, doing something like this. So that's an important part of my professional, you know, career that I feel very strong about, and the work that I'm doing with diversity, equity, inclusion, whether it's on the boards that I'm on or here at Sinai, those are the things that are going to be very, very important to me to continue.
What about your personal bucket list?
Life is fragile, right? And I learned that lesson. Not that I didn't know that before, but COVID really humbled me with that. So I want to spend real quality time, but not only quality time, because I've always spent quality time with my daughter. I want to spend more time, more quality time. And so I really do need to protect that part, because life is fragile, and I want to make sure that I enjoy every bit of my daughter, my family, my friends. So I'm allowing myself to have more of that, of being able to stop for a moment and go and visit with a friend, have a cup of coffee. You know, those are the memories that are going to mean the most to me and to the person I'm sharing that moment with.
That's awesome. Okay, I am going to open up questions to the group. But because there are so many of us, and I'm afraid somebody's going to raise a hand or something, and I won't see you because it might be on the flip side of the screen. You can either type your question in the chat, or if you want to ask it verbally, put it in the chat that you have a question, and we'll be able to make sure we call on you that way. Okay. So while we give them a chance to do that, let's see. Okay, I'm looking around. It looks like there are some people looking down. I can't tell if they're typing or not.
I will say that this is, you know, when I shared my story with the high school kids, they always take a bit or a couple of bits of pieces, and I think it helps, you know, to reflect on your life and where you've been and where you're going. So I do appreciate that you guys are doing this, because, you know, for the person that's being interviewed, it is about really self-reflection and taking a moment to really understand that.
Well, I'm glad you got the opportunity to do that self-reflection, because I know that so many people don't. And when you look at a career as expansive as yours, it's really cool. All right,
Thank
so
you.
there is somebody who posted, "Thank you, Yvette. You are truly inspirational."
Oh,
So I
thank
thought you
you,
might like.
Ugo. Ugo is inspirational to me. Ugo and I go back, way back. So.
Okay.
Wonderful mentor that she is.
Oh, thank you, Ugo.
Anybody else? Okay. I think.
Hi, this is Ann O'Neill. Sorry, I'm having some trouble with my IT issues here, but I just wanted to say that I am privileged to be working with Yvette over the last 2.5 years,
Thank you.
and the passion that she displayed today as she spoke about her career and what she does for our patients in our community and our nurses is really a true picture of how she is every day. She takes care of her staff, she takes care of her patients, and we're learning that we have to start taking care of ourselves as well. So thank you, Yvette. I appreciate all that you have taught me over the last 2.5 years.
Thank you, Ann. And you've taught me as well. And we've been a really great team. And I really appreciate that. As I said before, the team that we have in emergency medicine, it's just amazing. They are just all amazing. The leaders are all amazing. And you can't do it alone, right? Like it's like, it really does take a village.
Right.
All right, there is another comment in the chat. The drive and passion Dr. Calderon brings is exactly where we need to be. Lucky to have her in the ED. And that's from Martine Baptiste Playton.
Thank you, Martine. Martine is doing a lot of work in the diversity, equity, and inclusion area as well. Mm-hmm. And I think that, I don't know, I think it's a breath of fresh air to be able to do this work and have it recognized. So it just really is. For so long, it wasn't, right? Mm-hmm. And now to be able to say, we're doing this work, and guess what? This is work and it counts, is important.
Well, that's a great segue into another question that we do have in the chat. What advice would you give to those who are passionate about being a part of this work toward change, but don't feel the support from their leaders?
That's a great question. I think it's about resilience, and it's about getting mentors and sponsors outside of where you work, outside of your department. Whenever I've been in that situation, and I've seen that, you know, the people that I was with and the people that were going to make determinations as to whether or not I could do something were not going to allow me to, because they didn't think it was important, I found my resilience, I found my strategic way of dealing with it outside of the department. And I think that there are a lot of individuals throughout the system, and wherever you are, whether it's Sinai or anywhere else, that you can find individuals that you can have those conversations and really have a sense of by getting together and sharing your stories, you learn from each other, and B, strategically, they can see things from your story that perhaps you can't see and can give you some guidance in that way. There are times in my life that, my bosses did not agree with me, but in finding people outside my department, outside of emergency medicine, they were the best, mentors, and they were the best people to give me a different perspective, put a different lens on the issue that I was trying to work on. But I will say this, I was the Dean of Diversity, Equity, and Inclusion, and we did a lot of changes at Einstein, and I was very proud and still am of the changes we've done and all of the students that I had during that time. But it came to a point where I knew I couldn't do any more in that role because I wasn't being allowed to. And so I needed to step down to get out of the way so that someone else could come and just push the agenda a little bit more. And sometimes you have to do that. And I was okay with doing that because I really felt that that office was so important to the kids, to the students, to the faculty, that there needed to be, it's kind of like playing football, you hand it off to the one next to you and then you hand it off to the other one, whatever it takes to get to that touchdown, right?
Right.
And that's how I saw it. And so I think there are going to be times where, you may have to step aside and let someone else, push the agenda through. But, finding that mentor or sponsor also is helpful. The sponsors that I have had in my life have been tremendous and have given me opportunities within my workplace that, have led me here today, right, to be a chair in a department. So I think that is also quite valuable. Yeah.
Thank you. And this is my moment to plug our mentoring program that the Diversity Council is doing jointly with, I don't remember who we're doing it jointly with.
All of the diversity councils and employee resource groups.
That.
Oh, great.
So all of the diversity councils and employee resource groups are together, putting together a mentoring program for people to either sign up as mentors or as mentees, and more to come on that. So we have another question in the chat for you. What is your favored self-care practice during these especially busy days between DEI work and C-19 work? So between diversity, equity, and inclusion and COVID-19, what do you do?
So you get a dog, you get a pet. Actually, my daughter brought home a dog before COVID-19, like 6 months before. And Jax has been everything to me during this time. I mean, she went to college, so she had to leave the dog with me. And so now he's mine. So, she doesn't know that yet, but he is.
She'll find out.
That's part of it, right? Because it was going on long walks with him, and self-reflection. I have to be honest with you. I've done so much more self-reflection during that time and now than I have ever done in my life. Because, when you're in medicine, you're constantly going to the next thing, right? You're constantly going, and sometimes you don't stop and think. And that right now, that's what replenishes me. And I think that it has given me a different perspective about my life and how I want to live it. And so, yeah, my dog Jax and I spend a lot of time together walking and reflecting. And sometimes I have conversations with him. He listens really well.
But how's his
Sometimes he falls
advice?
asleep, But
How's his advice? Should we all be talking to Jax?
you probably want a Jax of your own, you know?
Well, thank you for that. Oh, we have another chat that just, another comment that just popped up. I don't have any questions, but I do want to extend my deepest condolences to you and your family for your loss. Thank you for taking the time to speak with us today and sharing your experiences. A huge thank you and a virtual hug for all you have done for the community and patients in the Mount Sinai healthcare system.
Thank you.
And that
Thank
came
you very
from
much.
Melissa Castellano.
Thank you. I appreciate that.
That was very nice. Anybody else?
Yeah, hi, this is it's Frank Pabon.
Hi, Frank.
Hi, how you doing? I don't have a question, but I want to echo what everyone is saying and thank Dr. Calderon for what she's doing. You know, I co-lead the Heritage of Latinx Employee Resource Group down at Corporate Service Center with Sean Lee, and I'm on the corporate on the Diversity Council. And it's funny because part of the conversations that we've had within our employee resource group was the gaps and disparities of healthcare. We've actually been having those conversations for some time now. And we were always wondering, you know, whether there's more that could be done to narrow that gap. And it kind of, you know, it's really nice. I'm happy that I joined today, and it's really nice to hear the passion in your voice. And it's, you know, as a fellow Boricua, it's nice to know that there is someone like you who's passionate and looking at this because, you know, it wasn't until I got involved with diversity, to be honest, that I even thought about things of that, right? Because we just, you know, growing up in the South Bronx, we just think things are the way they are. And we don't question it as much. At least I know I did. I didn't question it as much. But I wanted to thank, sorry, lost my voice there. I wanted to thank you, basically, is what I wanted to do.
Thank you so much. I really appreciate that. And you're absolutely right. I mean, you know, growing up and my family immigrated from Puerto Rico here, my grandparents, you know, accepting things because of fear, you know, at times, and because at times they just trusted so much, especially if you went to a physician, if you went to the doctor, you just trusted them. You allowed them, you didn't feel like you had a voice. And honestly, that has changed now. And I think we need, again, to be that voice of, so what is it that you want out of, you know, your care, out of the treatment that we're giving you? I think that's really super important as well. The voice.
Yeah. I'll say definitely what we were discussing is, you know, what kind of questions, you know, physicians do ask, you know, their patients. Do they understand the geographic location and where the patient is coming from and what it is that can be impacting their health? I guess those are some of the questions that we were discussing, right? Because I know for myself growing up, and I don't know, maybe I'm getting a little too detailed, but, you know, growing up, you know, a roach and a mouse in the apartment was nothing. But, you know, that can have potential health impacts if you really start to, you know, to think about it. And were those questions being asked because, you know, that can, you know, affect the person's health. And what made me start to think about that, ironically, was something different. It was more on the education side, where my daughter, as a young child, had to take a test to get into a grammar school, and they showed her a picture, and she said donut, and they said, no, that's a bagel. And well, where she comes from, aren't any bagels, there's donuts. So it's not that she got the answer wrong. She only said what she knew. And I started to apply that as I got more involved in diversity. And we started to question, is there more that the physicians at Mount Sinai can do to help narrow that gap, just by the simple fact of understanding the geographic locations of the patients that they serve. I don't want to take up everybody else's time, but again, that's what led me to that, and that's why I'm happy that Dr. Calderon, that you're involved. Thank you.
Well, thank you. And I have to say that school needs some lessons in diversity, equity, and inclusion because of what you just said. Understanding where people are coming from and meeting them at where they're at is really important. If that school really wants diversity, then they will see that their test is flawed in so many ways. And don't get me started on exams and testing and how it has eliminated the possibilities for so many of our patients and individuals that come from poor backgrounds, has limited their access, right? Because I mean, that's part of the conversation as well. And I have to say, yes, that is taught, and it's up to the faculty to remind the residents and the medical students, right, that is so important. That's why it's so important to really change the face of medicine. We have to be able to reflect our patients so that we can understand them more, right? Or the other thing we have to do is we have to be able to provide different programs that allows you to be able to go into a patient's house and take a look around and see how they live and how what you're asking them to do, how does that, or, does it jive with how they're living, or is it just not going to help them at all because of how they're living, right? And you need a different management plan. These are all the elements I think that are super important in our discussion when we're talking about, equity, disparities. It's about that, and it's about understanding the different cultures, right? I'll share this a small story. When I got here, I decided I would do what I do best, which is just go to every senior home, every, school that would let me through the door. And I would take my team with me, and I just knocking on people's door and saying, hey, this is my name. I'm here. I work at Mount Sinai Beth Israel. We're open, by the way, and then asking them to give me feedback. And I remember going down to Chinatown a couple of times, and I learned the most important thing. One of the people that was at the senior center gets up and says, I have to tell you, this number, I forget the numbers now. I think it was 8 was something profitable, and then 4 was not, or 2 was not. Something meant death. One of those numbers meant death. And he basically said, like, when we look at the phone number that Sinai has, for whatever it was, there are a lot of 2s in it. I'm making it up, but like whatever that number was, there were too many of it. And to them, it meant that you were welcoming them to death. So, I mean, this is the cultural stuff. Like, if you don't go out and have these conversations, I mean, I'm all about mixed methodology too. And I love doing focus groups, and I love doing interviews, because that's how you learn, right? What are the important things that make sense to that community that you would never have known? I would never have known.
Things you wouldn't have guessed.
Yeah.
Yes, it's actually number 4, because as property manager for the hospital housing for the house staff, I had to remind my supervisor at the time that no, we can't place this family on the 4th floor because the number 4 is associated with death. It's like, we need to put them in any other apartment but the 4th floor. So yeah, to have to know, not to have to, but to recognize that there are those kinds of associations. Yeah, it helps in making everyone feel welcome, that we couldn't be so stringent and say, no, you get one offer, that's it,
Right.
regardless of the circumstances. There are exceptions and considerations like that. So.
Thank you for speaking up. That was it. And I just thought to myself, part of the reason I love going out and going to the different communities is because I learn so much. And so that when I am taking care of a patient, and it gives me a little bit more of a little glimpse into what's important to them and their community. So thanks for sharing that.
do we have any other questions or comments?
Well, I thank everybody
Okay.
for coming and hanging out for an hour to hear my story. I truly appreciate it, and I am humbled to be here, and I am humbled that you all wanted to hear my story, and I appreciate all of you very, very much, and I appreciate all of you that are doing this work and in this space of equity, inclusion, diversity, in the space that is really fighting against racism in our structurally and in our day-to-day encounters. Like I said before, there's a lot of work to do, but I am so convinced we can do it together. All of us have a place where we stand that can actually contribute to this. And I think if we see ourselves in that way, whether you're in IT or you're in the ED or you're, in corporate somewhere, we all have a place in really battling this. And I really believe that we can together, find some really great solutions. We just can't give up.
So we haven't, go ahead. I heard somebody start to speak.
Well, yeah, it's Frank again. I was just going to say real quickly, Dr. Calderon, if there's anything all I could do and help you, just feel free to reach out.
Thank you so much, Superbone. I really appreciate that.
So we have a few thank yous in the chat for you from some of our participants. Let's see. As things are starting to scroll, hang on. Right there. So I've got, I think I read this before. Thank you for your commitment to our community and the passion you bring to your profession. Thank you, Yvette, for sharing your amazing journey. Love how you always come back to that it takes a team. Thank you very much, Dr. Calderon, for sharing your experiences with us. Truly inspiring.
Thank you.
Thank you for sharing your story. It's very inspiring, and thank you for your time. We appreciate all you do, Dr. Calderon.
And I appreciate all of you. So thank you so much for coming. And if I can do anything for any of you, please don't hesitate to reach out.
So thank you for speaking with us.
Have a beautiful day and a beautiful week.
Bye, everyone.
Bye-bye.
Hey, bye.